Hi, everyone. Welcome back. Today, we're joined again by Dr. Eddie Stenehjem, our infectious disease doctor for Intermountain Healthcare, who's been with us through this entire COVID-19 process. Just to give a little update on what's been going on since last Friday when we spoke. Eddie, thanks again for joining us.
Absolutely.
So our first thing I want to talk about is numbers. So last week we switched from a moderate risk to a low risk, and 2 weeks prior to that, we had switched from a high risk to a moderate risk. So it's been about 3 weeks total since we've opened up parts of our economy in Utah and seen an increase of people out and about. Yesterday, the reported case count was 7,874 total positive cases, 92 deaths, and 647 hospitalizations. So let's talk a little bit about what that means as far as an impact to the community.
Yeah, so you're right. We've gone through some really big transitions here in the past 3 weeks, starting with May 1st, going from red to orange, and then quickly following thereafter, going orange to yellow. Except for some communities, but now we know that Summit County is going yellow as well. What we've seen in terms of case counts is just a plateau. It's a pretty painful plateau. We haven't seen cases really go up, but we definitely haven't seen them go down either. And so you have to ask yourself, what would have happened if we would have stayed red, for example? And most likely what would have happened is that we would have seen a decline in case counts. And I think what we're seeing now is that the loosening of restrictions, the economy opening up, is now just contributing to kind of a low plateau baseline case count, where we're still seeing anywhere between 125 to 200 cases per day being identified. We're still seeing plenty of people being admitted to the hospitals, about 10% being admitted to the hospitals. Of those that are in the hospital, about a third to a half end up in the ICU. We still see plenty of people getting sick. If you look just at Intermountain Healthcare and you look at the total number of patients with COVID-19 in our hospitals, that number has stayed constant and consistent, and it's anywhere between 65 and 75. We actually had that number go up earlier this week. We had the highest number of hospitalized patients that we've ever had. And now that's still just kind of plateaued. So, compared to last week, our case counts are about the same. There's still plenty of people getting sick, and plenty of people, being really devastated by this infection.
Yeah, I know that we've always talked about that the number that's really important is that hospitalization number. And that's what we really should look at in terms of if we're doing better or worse. And I was going to mention that this week we had the largest spike.
Right.
So I'm glad you brought that up. But I think it's interesting to note that we haven't started declining at all yet. Even though we've reopened back up, whether that's a good or bad thing, it'll be interesting to see what happens over the next couple of weeks.
Yeah, I think what's going to be a challenge is that if our case counts just stay stable, this may be something that goes through the summer. And right now, we're not having any indication that our case numbers are declining. We're actually watching certain areas closely because we're seeing increase in case counts. For example, down in Washington County, in St. George, we've seen a signal that counts were increasing there. And so it definitely looks like we're going to be in this for a little bit, and we're really going to have to be staying on top of these numbers. And if we start seeing these numbers go up, we really need to start thinking about how do we move back to, orange, and I hope not, or red.
Yep. Another interesting thing that happened is the CDC released an MMWR report about this choir practice that happened. It was a high attack rate. Someone who was symptomatic was at this choir practice, and they were there for a few hours in a pretty tiny space. And now approximately 87% of the people that were there have COVID-19 or suspected COVID-19. Can we talk a little bit about what that means when we start to gather more and start to have these team practices again, whether they're indoors or outdoors, will probably make a little bit of a difference. But we're seeing that this is still something highly spreadable and transmittable if you're in this tight-knit area.
Absolutely. I mean, this was a case of 60 members of a choir, and one member of the choir was symptomatic with COVID-19, came to the choir practice. Choir practice was 2.5 hours long. And of those 60 people, 52 of them either a confirmed or probable COVID-19, which put it at an attack rate of 87%. I mean, that's just incredible. And I think what it highlights is that singing is clearly being identified as a very transmissible event. And so loud singing, vocalization like that, which is very different than just quietly talking, can lead to potentially aerosolization of the virus and spread of the virus, especially if you're in a contained environment. And so, that's a very interesting case study for us to think about. But then you have to think about, well, what does that mean for us? And so I think about things of places where people are singing or yelling and talking loudly, and I immediately think about, indoor sporting events. For example, the Utah Jazz. What does this mean for that? What if you had a symptomatic fan who is yelling and now infecting all these people? You can also think about religious services and places of worship that do a lot of singing and what that potentially could mean. And that could, have a negative impact and certainly be something that really increases spread. Also, sporting events where, you're a lot of screaming and yelling and those types of things. Some of those are outdoors. And so you're actually got the benefit of increased ventilation, and you're not in a small room. So your transmissibility is going to probably be less, but it really does show what aerosolization, time spent with somebody and in enclosed quarters, what that can do to transmission. And it's really pretty significant.
There's a bunch of sporting events or teams trying to think about how they go back to sports. And I know like the NHL Hockey League is starting again, but they're not going to have fans. So that's
Right.
something interesting that a lot of these sports teams are doing. They want you to be able to watch and enjoy them. You just won't be able to be there, which I think is probably going to be the way of this summer and maybe the fall, which will be interesting. Right. Another question that I have been getting all the time, or Intermountain has been getting all the time, is that people are thinking that they had COVID-19 back in October or November of last year when coronavirus wasn't something that we were tracking or looking at. No cases had been popping up. Can you talk a little bit about that, and if you think that that's actually something that's possible?
Right. So, what we know is that we saw our first cases of coronavirus here in Utah in early March. That's documented cases in Utah when we saw community-based transmission start. Really, the epicenter was up in Park City. I've gotten this question a lot too. I really think I was symptomatic. Many of these are, whether it be patients or healthcare workers, and those people have gone on to serology studies. So this is a great example of where you can use a serology or an antibody study. These people say, I really thought I had COVID-19. I had the symptoms that were consistent of it. And almost invariably when we do serology studies on those people, they're negative. And so we haven't seen any evidence that COVID-19, SARS-CoV-2 virus was circulating in our communities in November, December, January, even February. Could it have been? Yeah, I suppose it could have been. And I bet if it was here, it was at really low and sporadic levels and really didn't take off in terms of a local epidemic. We can't rule that out. But what I can say is that in those months, we weren't seeing patients in the ICU dying of florid viral pneumonia that we couldn't diagnose. And if we had had widespread transmission in our communities in those months, we would have seen that. Right now we have over 30 patients in just Intermountain Medical Center with the same viral infection. And we were definitely not seeing that back in November, December, January. So could it have been? Yeah, maybe it could have been circulating at low levels. We haven't seen any evidence, though, that it was actually present. We can't forget that last winter was a pretty rough flu season. We had a lot of influenza B early on, then that converted into influenza A. In addition, we had a lot of RSV. It was a tough viral season even before we got to coronavirus. So I suspect, and this is what we've talked to our healthcare workers and other patients, those people that really thought they had coronavirus back then most likely had either influenza or one of the other respiratory viral illnesses.
Yeah, that's what I was going to bring up, is that I think people need to remember that that's the very typical time for the flu.
Mhm.
And the symptoms are so similar that they probably had that. Maybe it was a case worse than they've had before too. So they thought it was COVID,
Right.
but it's good to see that we don't have any evidence of that. And hopefully that helps a couple of people as well. So this
Right.
weekend is Memorial Day weekend. It's our first long weekend of the summer, and it's typically a
Mhm.
weekend of lots of people gathering, barbecues, hanging out with friends and family. What are some of your suggestions on how people can stay safe this weekend, but
Yeah.
still engage in a little bit of fun?
Right. It's a great question, incredibly timely question. It's beautiful out. We want to get out. We want to do a little socialization as much as we can. Things to think about. Really be cognizant of who you're inviting over into your group, who you're socializing with. Really pay attention to what is your risk. What is your risk of getting the infection? If you get the infection, how severe will it be for you? And then also consider the risk of people that you're exposing. For example, if you live with, elderly parents, for example, your risk profile is going to look a lot different than somebody else's that maybe lives alone or with a partner and they don't have small children. So really be thoughtful about that. And then if you are gathering, I would say gather outside as much as possible.
Mhm.
If you can be outside, we suspect there's much less transmission when you're out in ambient air. And then also just be cognizant of sharing drinks and sharing utensils and those types of things. And, this is probably not the time to be saying, oh, here, try this, just be a little more aware of that. And then, the yellow indicator says you're supposed to have people, groups of 50 or less. I would definitely say 50 or less. I'm a little more conservative when it comes to this, and I probably wouldn't be gathering in more than group sizes of 10 to 15. But that is really going to be a personal decision. So I guess in summary, it would be gather in groups that and other people's risks and that they've taken this seriously. Try to gather outside. Be careful with shared items like cups and cans and sodas and beers and those types of things. And really think about what is the risk to you, yourself, and your loved ones.
Yeah, I think we talk about this every week, that it really is up to you and your comfort level. We can't change someone else's behavior. We can only really impact our own. So just considering that is really important. I
Mhm.
also have been getting a lot of questions too about if people can become infected with COVID-19 more than once, and if we have any evidence to support this either way. Do we for that, or are we not quite there yet?
We don't. We don't have any evidence yet of somebody getting acutely infected with COVID-19, getting fully better, and then getting acutely infected again. There are a number of stories that have been stating that shows people getting reinfected. And how they're defining that, though, is that these are people that have had symptoms and acutely ill with COVID-19. They found the virus in their nose, then they retested them and they were negative, and then they retested them again and they were positive. And so what we know is that people can shed this virus from their nose and their respiratory tract for a long period of time. And once that test turns negative, it doesn't mean it's fully gone necessarily. And what we're seeing is people potentially have a really long tail of positivity on that acute nasal PCR test, not the serology
Mhm.
test, but the one that detects the RNA of the virus. That can stay positive for a long period of time. And so if you keep checking and check long enough, you're going to continue to find it. What we're seeing, though, in the data is that those people that carry that virus a long period of time, they're not very infectious. And actually, the viral burden in their nose is really, really low. And in most cases, we can't get that virus to grow. So what that means is, yes, your test is positive, even though you may be weeks out, but that virus isn't alive and it's not transmissible. And
Got
so
it.
that's what's really kind of confusing some of these headlines, is that, yeah, you can shed virus for a long period of time. It can shed on and off. But that shedding isn't necessarily a live virus or virus that is transmissible. Clearly, this is work that's ongoing and more studies are needing to confirm this, but that's really what the science is looking like right now. And we haven't seen any reinfection as of yet.
I'm going to ask you a few questions we've gotten during the live too. One of them is about school in the fall. And if we think it'll have to be online, if there's a chance we could go back in person, I know a lot of that has to do with the government's decision on what happens with that. But what are your thoughts?
It's going to be a really hard decision, especially if we go through the summer with kind of consistent case counts the way they are. It's going to be a really hard decision for our elected officials and for our, our education board to say that we're going to. It really is going to depend on what happens this summer with our case counts. And if we see a decline in case counts, coupled with potentially, new testing modalities, maybe we test everybody once a week to see if we can find people that are positive and pull them out of classes and those types of things. That could certainly open up that possibility. For me, obviously not speaking for the education board or anybody like that, I think this is going to be a really hard decision, and I don't think we know yet. I think a lot can change this summer, both for the good, and maybe the virus will really decline and we'll feel good about going back, and we have to be really cognizant of new cases and the counts go up or remain stable. I think that's going to be a super hard decision to make. And that's a big decision that has effects economically and also education. If you're pulling kids out of school, that means parents aren't able to work, and it has such big ripple effects from the economic side and from the public health side.
It'll probably depend on the level of schooling too, and how big classes are too. I'm assuming if you're in a graduate program or something that's smaller, maybe they'll say, okay, that's fine. But in big classes or big college classes that are over 100 people. So I think it'll depend. So like you said, we'll keep track of that and hope for the best. Another question is very similar to this about large gatherings in August. And if you think that's going to be possible. In my opinion, a gathering of 50 feels like a large gathering, but maybe to others it's still pretty small. So I guess it depends on what you clarify as a large gathering.
Yeah, I'm going to say it kind of really depends on what we call a large gathering. August isn't that far away. It's 2 months away, but certainly a lot can happen from the virus standpoint. And also what happens with our kind of governmental restrictions going from yellow to green, whenever that may happen. I think our case counts go down. I think, we probably are going to be able to hold some of these large gatherings, but I think we have to be really careful and cognizant of what that means. I can tell you personally, I'm not going to be going to any indoor large gatherings anytime soon, regardless of what our case counts do. You start thinking about, well, what about summer concert series that are held outside and those types of things? I think they're really in jeopardy at this point, just given our caseload. I think groups of 50 probably are going to meet and do okay, but I think these true large gatherings, we really have to think long and hard about whether we want to have those or not. Because when you think about a large gathering, that's the perfect place for transmission, because typically what happens is at a large gathering, you have people coming from different geographic sites to a central location. And so then if you have a spreading event at a large gathering and you infect many people, those people then take it to all these different communities, got action all over the state from one spreading event. So from a public health standpoint, those are really challenging to both work up and also such a really high risk time period.
And to people watching, I apologize for the freezing. My internet's having some issues, so if that's happening, I'm sorry about that. But last question really quick from the comments, and then I'll get to the other few I had for you. And this is a tough one, but about surgeries that requiring a hospital stay and when we think those are going to happen. I know I talked to Rebecca Cooper-Knowles on Wednesday about this, and it really depends on how, at least what she said, how things move along, and that there's a different guideline for healthcare versus the state as far as a coding system goes. But you can probably speak to that more.
Yeah, actually, I think that's probably the best answer to it. I can tell you that they're looking at this very, very closely. We have hospital capacity at this point in our facilities. And I know Intermountain is really trying to parallel a lot what the state is doing, but also keeping in mind those other guidelines that you mentioned. So, I think if things continue to improve, and potentially case counts start going down, we're definitely not seeing increases. I would suspect that we would see the government moving to green in the near future, and then I could see hospitals coming online soon thereafter. Again, that's gross generalization. I can't speak to whether Intermountain's going to be offering overnight stays for surgery, but I suspect that's what hospitals will be looking at. Do we have the testing capability? Do we have the bed capacity to be able to do these things? And if case counts improve, I think we'd probably see that happening relatively soon. And so that's what we hope. There's plenty of people out there that need, they call them non-emergent surgeries, but like people are in pain from, bad arthritis of the hip, and they need these procedures and need them quickly. So I know it's a really top priority for hospitals across the state.
Yeah, and I think to this person's question too, we're not doing this to harm anyone or to keep you from getting your surgery. It's to help and keep you safe in case something goes wrong or there's a higher risk level for some reason. Right. It's really to keep the people in the hospital as safe as possible for the duration of their stay as well. So last question for, sorry, go ahead.
Yeah. I was just going to say,
go ahead.
We've learned a lot in the past. We've learned a lot in the past 2 months in terms of our personal protective equipment, and we feel really comfortable taking care of patients in the hospital, both to make sure that they stay safe and that we as caregivers stay safe. And I think we're getting more and more comfortable with that. We're more and more comfortable with our personal protective equipment. We have adequate, resources and stores of that, and so I think that just adds to our comfort level. And we really would like to be able to offer these services as soon as we can.
Yep. So last question for you. That way I can let you go enjoy your Memorial Day weekend. I want to talk really quick about vaccinations and where we are in terms of getting a vaccination for COVID-19.
Yeah. So you may have seen some things in the news. There was a company that released some very early preliminary findings from what's called a phase 1 vaccine trial. This is where they're using the vaccine for the first time in humans, and they're looking to see, is it safe? And then does it actually make any antibody levels that would be of use in terms of protecting you from this infection? And so these are really prelim data from a company called Moderna. They had vaccinated 45 people, and they said all of them developed an antibody response to the vaccine. And specifically in 8 patients, they said that vaccine response was as high as people that had gotten infected this traditional way through active infection. They didn't report out on all 45. They just reported on those 8. So it's a really small population that they reported on. So there's obviously lots of skepticism, and we need to see the data and those types of things. But it was initial early report that was a little bit of a glimmer of optimism, and that it actually produced antibody levels that were appropriate. And those antibodies are called neutralizing antibodies. They're antibodies that essentially inactivate the virus in the bloodstream. So this is just a good first glimpse of some good news. And I think we all needed some good news. But we're a long ways away from a vaccine to reach the public. So we've got about 6 vaccine candidates that are in what are called phase 1 or phase 2 clinical trials. So it's where you're testing them in humans. And then there's about 75 other different candidate vaccines that are kind of moving through the process. And so there's a lot coming in terms of vaccine research. After phase 1 is phase 2. Phase 2 is where you use the vaccine in more like hundreds of patients, to maybe 50 to 200 patients. You use that, and you're again looking at safety and whether or not they generate an immune response. And then comes phase 3, which is where you're using the vaccine in thousands of people, and you're saying, is it effective? Does it actually reduce the risk of getting infected? And so what I anticipate is that we're going to see phase 1, phase 2 trials popping up. We're going to start seeing results here in the coming probably days to weeks to months. I anticipate those will be going over the summer. And then we may start seeing phase 3 clinical trials starting in the fall. as long as they pass through phase 2. And phase 3 trials would then be launched in the fall, where we're trying to get thousands of people to sign up and see if the vaccine's effective. Usually those vaccine trials are called randomized control trials. And so people will come, they'll say, yes, sign me up, and they'll get a vaccine. But that vaccine could either be a real vaccine or it could just be an injection with saline. And that's the way you try to understand whether these vaccines work or not. That's what I expect to happen. Whether or not we'll be able to attract some of these clinical trials into our communities in Utah is something that's actively being pursued right now. I really hope that is the case, that we could potentially bring some of these trials in early. But if not, I would probably still think we're on track for potential vaccines, if everything goes well, probably into 2021.
That's really great information. I think that's important to keep remembering, is that the vaccine is really important in all of this. And the hope is that we have one soon, so that way we can get life back to normal and continue about it. Eddie, thank you so much for joining us today. We really appreciate these conversations. And just so everyone knows, we still have our COVID-19 hotline available for people to call. That number is 844-442-5224. You can get screened for COVID-19 and then get tested for it as well, as long as you have one symptom. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Eddie, thank you again, and we will talk with you next week.
Okay, take care.
Bye.
See ya.